Very good morning to all. Today's topic is on single visit endodontics. I'll be covering under the following contents. So, coming to the definition of single visit endodontics is conservative non surgical treatment of an endodontically involved tooth consisting of complete biomechanical preparation and obturation of the root canal system in a single visit. What are the advantages of single visit endodontics? First one, the clinician has the most intimate awareness of the canal anatomy immediately following instrumentation. There is no risk of losing important landmarks. The canal is never cleaner than immediately after proper instrumentation. Next, it eliminates the chance of inter-appointment microbial contamination and flare-up induced by leakage of temporary seal. The teeth are ready sooner for final restoration, diminishing the risk of fracture necessitating extraction. That means the post-endodontic restorations can be given immediately. Patient's pre-operative anxiety and post-operative pain is limited to a single appointment. Time is saved for both practitioner as well as the patient. Less cost, that means it is more economical. In anterior tooth, it allows immediate use of canal spaces for retention of post and construction of an aesthetic temporary crown. And the last one, it eliminates the problem of patient who does not return to have his case completed. Now coming to the disadvantages of single visit endodontics. No easy access to the apical area in case of flare-up. Clinicians and patient fatigue and discomfort with extended operating time. If the cases done are difficult, there will be increased operating time. No opportunity to place an intracanal medicament. Difficult cases with extremely fine, calcified, multiple canals may not be treatable in single appointment because it requires more time. If hemorrhage or exudation occurs, may be difficult to control it and complete treatment in one visit. Clinicians with lack of experience could end up causing flare-ups and finally endodontic failure. So we have covered the advantages and disadvantages. Now coming to the indications and contraindications of single visit endodontics. Indications, they are indicated in uncomplicated vital teeth, fractured anterior teeth or bicuspid where aesthetics is a concern and temporary post and crown are required. Patients who is physically unable to return for treatment completion. Patients with heart valve damage or prosthetic implant who require repeated regimens of prophylactic antibiotics. Necrotic uncomplicated teeth with draining sinus tracts. Patients who require sedation or operating room for treatment. So these are the indications. Coming to the contraindications, painful necrotic teeth with no sinus tract for drainage is a contraindication for single visit endodontics. Teeth with severe anatomic anomalies or cases with procedure difficulties. Asymptomatic non-vital molars with periapical radiolucency and no sinus tracts. Patients with acute apical periodontitis with severe pain and percussion. Most of the retreatments they are done in multiple visit endodontics, cellulitis cases, acute abscess requiring incision and drainage, weeping canals that cannot be dried, difficult cases that extend beyond our allotted time and patient's tolerance, possible increased stress on TMJ musculature and increased psychological stress. These all conditions are ideal for multiple visit endodontics. Now coming to the base, so we have covered the advantages, disadvantages and indications and contraindications of single visit endodontics. Coming to the basis of single visit endodontics. The cause of pulpal and periapical lesions is bacteria. The treatment requires thorough mechanical and chemical disinfection of the root canals both for vital and non-vital cases. Whether this objective can be obtained in single visit or multiple visit is debatable. Non-vital cases require a medication in the canal between appointments to kill most bacteria, including those in the dentinal tubules. This question is this approach is questionable. Coming to the economics of single visit endodontics. Single visit endodontics is profitable both to the patient and the practitioner, because the practitioner have only one appointment, and it is a loss if it is stretched to 2 to 3 appointments. Patient no long lost hours of work and needless travel. Coming to the post-operative pain following single visit endodontics, the incidence of post-operative pain following single or multiple visit endodontics varies considerably. However, most of the studies shows that one visit root canal procedures produce no more pain than multiple visit endodontics. Most studies have shown that when pain occurred, it was invariably more intense in the first 24 to 48 hours and declined after the first week. Flare-ups. Flare-ups following the single visit endodontics. According to most, the swelling and pain combined or swelling alone that necessitates unscheduled emergency appointments. This is the definition of flare-up. And incidence of flare-up of teeth treated in a single visit. It occurs usually in teeth without apical periodontitis, and the following findings has been put up related to flare-up. First, teeth without apical periodontitis did not flare up. Teeth with apical periodontitis with no previous root canal treatment showed less flare-up. Teeth with apical periodontitis which needs retreatment showed highest incidence of flare-up. Various techniques of biomechanical preparation was performed to check for the incidence of flare-up and post-operative pain, and it was seen that the incidence was the same for all the techniques, leading to a conclusion that technique did not matter. However, it was seen that balance force technique and double flare technique produced less flare-up and pain owing to less apical extrusion of debris. Use of ultrasonics with 2.5% sodium hypochlorite also produced less flare-up, as less apical extrusion of debris was there. And following are the reasons for less amount of flare-up in single visit endodontics. Bacteria and other irritants are not allowed to remain in the empty canal as isolated from the healing system. Deletion of the intracanal medicament that can elicit an immune reaction. Early sealing of canal eliminates bacterial ingress from a leaky restoration, lateral canal or caries. Success rate in single visit endodontics compared to the multiple visits. Most studies indicate that there is no substantial difference in the success rate of one visit and two visit endodontics. Now we have compared few characteristics between the single visit and multiple visit. Now coming to the guidelines for single visit endodontics. The guidelines, they form a triad. They include accurate diagnosis, proper case selection, and a skilled operator. As a guideline, the single visit, if you are doing a single visit, it should be completed within 60 minutes. And Oliet has laid down certain criteria for case selection, and they are positive patient acceptance. Second one, sufficient available time to complete the procedure properly. Third one, absence of acute symptoms requiring drainage via the canal and of persistent continuous flow of exudate or blood. Absence of any anatomical obstacles. Absence of any procedure difficulties. These 5 criteria are necessary for performing a proper single visit endodontic procedure. Coming to the essential of single visit endodontics. The essence of single visit endodontics is the quality of treatment, and it depends upon 2 main criteria: the working length and the working width. And working length is the distance from a coronal reference point to the point at which the canal preparation and obturation must terminate. It is the length at which the biomechanical preparation should be done and the obturation should end. That is the working length. And what will happen if you fail to accurately determine and maintain working length? It may result in the following. The first is it may lead to perforation through the apical constriction if the working length is long, overfilling or overextension, increased incidence of postoperative pain, prolonged healing period and lower success rate owing to the incomplete regeneration of cementum, pedial and alveolar bone. And if the cleaning and obturation is short of the working length, then it will result in incomplete biomechanical preparation and incomplete removal of microorganisms. That also can lead to certain discomfort. And there are various methods for determining the working length properly, and they are given below. Now coming to the second entity, which is the working width. Working width is defined as the initial and post-instrumentation horizontal dimensions of root canal system at working length and other levels. So what is the procedure of calculating the working width? Before initial working width is determined, widen the orifices, do early coronal flaring and additional canal flaring, which ensures effective irrigation and minimizes any interferences with the tactile sensation. The best method to clean the entire canal to complete working width is by doing circumferential filing manually. To conclude, the safest way to clean the canal is using nickel, titanium and manual instruments together. Even though the working width is larger than the original canal size, it results in better cleaning but is mostly ignored and is called the forgotten dimension in endodontics. So proper calculation of the working width is important for proper cleaning and shaping. Now coming to the recent advances that assist in helping the clinician to do the single visit endodontics more efficiently. First of all, coming to the X-ray, the development of digital X-ray, the CBCT, these all help in doing the single visit endodontics in a single visit more efficiently. Use of surgical microscopes also can help in doing the single visit endodontics. Use of apex locator for accurate measurement of working length. Using of nickel titanium instruments for proper biomechanical preparation helps save time. Use of ultrasonics that will effective irrigation protocols can be maintained by using ultrasonics. Then crown down technique can be used for proper biomechanical preparation. Then various systems help in providing better obturation, and these include system B and touch and heat and other thermoplastic injectable cut aperture techniques helps in better obturation following single visit endodontics. So by this I come to the end of the presentation.